are going to be,
There we
I know
go.
one of the topics about OCD is about how does it overlap with autism and how can you see where are they the same and where are they different. Also, what we want to do is just not provide you with information about OCD and how it overlaps with autism. We want to give you some tips and some ideas, some suggestions. One for anybody who has OCD and autism, but also for any autistic individuals. Apologies, there we go, the first slip. For any autistic individuals who have OCD, but also some information for parents and other family members. And apologies again. I know that I get my brain tied in knots going back and forth between the language. But again, the As I Am guide, it's really, really good. I've been sharing it with a number of my own colleagues in my profession.
Yeah, it is good. I remember reading it myself, it was great. Um, Next slide here. Okay, so many of you might think, OCD, that's kind of a washing hands thing, you know, just you like washing your hands after doing something or you wash them a couple of times. Whereas this could easily be OCD. That's not necessarily the truth of it. You might also think about this kind of lining things up, liking them a certain way, liking them to be really neat and tidy. But more close to the truth is kind of this idea of, real pain, real stress, overwhelming emotion, and like hands that have been just rubbed raw from being washed so much, somebody just really suffering, leaning over the sink. Um, so, whoops. Um, yeah, I'm just going to go back one. Yeah. So, different things about OCD, people think about these things about, oh, maybe I'm just a bit OCD, but we're hoping to kind of take that apart a bit, kind of understand what is OCD, what isn't OCD, what does it mean when people are actually saying that? Are they actually referring to having the disorder, or is there something else they're referring to? So we'll just get into the definition of OCD and then we can move on. Leslie, do you want to handle the definition and I'll come back?
Thank you. And what Alex has raised about that comment, I'm a little bit OCD. Something that Alex and I discussed when we were preparing this is how even with autism, oh, I'm just a bit autistic, and how these phrases are overused by common society. And so, what we really want to endeavor is hopefully dispel some of those myths and give you a better working understanding of all of them, because they're really dismissive of the personal experiences of people who experience OCD and autistic individuals and the experiences they have. OCD is, it's a neurobiological disorder, meaning it's in the brain. There is a debate happening at the moment, and Alex and I are on each side of this division. Is it neurodiverse or is it not neurodiverse? And we're not going to debate that today because right now we don't have an answer. But it is something that's happening within the community. So OCD has obsessions, which are unwanted and intrusive thoughts and impulses and images. And what happens is when people get these intrusive things, they want to make them go away. And that's when we do the repetitive rituals. They could be mental things like praying or counting, and they can be outward things like Alex has mentioned, washing hands, which again is, yes, it's a type of OCD, but there's lots of other types of rituals, outside rituals that people do. Unfortunately, I know with me and my world, just even with friends, when I mention OCD, they're like, "Oh, compulsive hand washers or compulsive cleaners. Send them to my place." They
Oh,
just, yeah. Once had
no.
somebody say, "I'll give them the toothbrush to do the floor," and I got quite cross. People don't appreciate that mental anguish that individuals who have those intrusive thoughts and images are going through. And Alex had that great image with, the bully with the whip, and Paul Sakofkis, who would be a big psychologist in the world of just OCD. He refers to OCD as the schoolyard bully because he keeps saying, do it one more time and I'm going to go away. But the problem is it never goes away.
Mm. I think we get a bit more of that on the next slide, actually, Leslie. Because we've got here, it's not quirky, fun, or useful. You know, we've had people, people kind of think, oh, you're just a bit quirky, you like things in a certain row, you like things to be a certain way. That's not what it is. It's not fun, it's not useful. You're not going to be able to bring someone with OCD to your house and have them clean your house out. I remember my sister was once told, oh, I wish I had OCD, so my desk was so tidy like yours. And she's kind of like, yeah, well, it took me hours to get here because I had to scrub my hands raw. Um, it's not like that. It's something that's painful and can take over your life to such an extreme degree that it can be more damaging, I think, than almost any of the many other disorders. Like, I mean, it can be totally encompassing. You can't even go outside to a certain degree. You can't do anything that you enjoy at all. It works against your value system and makes sure it can make sure that you have nothing in your life to look forward to. It can be really, really bleak. But after that,
Just, I
bleakness,
was going to flag real quick, Alex. OCD is in the top four most common mental health issues. It's
mm,
depression and anxiety. I always forget which takes pole position because it kind of swaps sometimes. Next one's anorexia and then OCD. So it is quite
mm,
common. And how
yeah,
Alex has described his sister's situation is really apt.
mm, yeah. I mean, it's really difficult. But as we said, like also just to mention here on our slide that OCD is not an anxiety disorder by the DSM-5 anymore. It's its own thing, separated from anxiety. Um, Anything else to say on that topic, Leslie?
Just real quick, for anybody who hasn't heard of the DSM, that's the Bible for psychologists and psychiatrists. It took them 15 years to revise the last one, lots of debate in the communities.
Mm,
But I thought it was a move forward to move OCD out of the anxiety world. Anxiety is a big feature of it, but there's other parts of it. The other thing was hoarding also got moved out of the OCD world. So hoarding got recognized as a disorder on its own, and OCD was recognized as a disorder on its own. So that was great progress.
mm,
I know other areas of the DSM-5, people are not happy
yeah,
about it, but I was very happy with those.
yeah, yeah. I know there's some debate over autism in the DSM-5, but
Yeah.
OCD has at least made a step in the right direction. Um, okay, so yes, there is a way out of OCD. Me, myself, I used to be consumed with rituals and obsessions every moment of my waking life. There was no moment in which I wasn't bound by compulsions and obsessions. Now I'm able to have a job. I was able to go to college. They are huge things that I've done. It's not gone from my life. I still have to manage it every day, but there's no way I'd have been able to go to work or go to college without getting the treatment that I did, which we'll be talking about a bit towards the end of the presentation. We'll be talking a bit more about the treatment. First, we're going to kind of decompress or kind of take apart what is um, OCD, deconstruct that, and try to find out the differences between OCD and autism. But it's important to know there is effective treatments.
Yep.
They do work. They're surprisingly simple when you actually get to know what they are, but still can be quite complicated once they get going. But
Well, they can be tough to stick with.
they can be tough to stick with, and sometimes they get a bit complicated, but they are surprisingly simple, I found. It's just you kind of feel mad at yourself for not thinking about it yourself. But yeah, we'll just move on past that one.
Well, if you
So
want to go back real quick, Alex, I
yeah,
think
of course.
support networks, some of the
Yeah.
stuff we're going to look at also are support networks like online support with support groups, discussion forums, things like that. But also, in the notes that are going to be sent out to you for anybody who wants them, I do have a book list, a podcast list, a few different things.
Mm,
Just to flag something though, and it's something that you're going to hear as a recurring theme in the presentation, the concurrence of OCD with autism, it's pretty common,
mm,
which, great, fine, we've established that. But for whatever reason, my world in psychology, we've been very bad about addressing this. So the resources for the overlap of autism and OCD are limited, for which I'm going to apologize on behalf of my profession.
mm,
I am going to flag, I know that one book I've put up is about autism, and it's for autistic individuals with OCD. It's for kids and teens. And I recommend it for adults as well. And the reason I'm saying that is during the pandemic, a particular book, my favorite book for OCD, is by a woman who calls herself Dr. Z, Dr. Zarita Uno. She's from Colombia, really cool woman. Best book on OCD there is, but it's just for OCD. And I was using her book for teens and kids because that predated it during the pandemic. The book was delayed by a year because of the pandemic. But I found even though the book was for kids and teens, it worked really well with adults. It's not perfect, but my clients did really well when I was using that book. So please don't let that intimidate you or put you off. Give it a bash. There'll be things in there that will help you.
yeah. And also, just to point out, some of the resources are likely not going to be as neuroaffirmative as we here at As I Am, but you still might gain some important things. I watched the OCD UK speech myself, with video myself, whereas, it isn't as neuroaffirmative. There is some really useful information about trying to discern what is autism and what isn't, even still. So, just to keep that in mind, OCD treatment and a lot of professionals haven't kind of caught up with that, how to address autism properly in that way, but there's still useful information there. And just then we can move on to what are obsessions.
Well, I mean,
So
Alex, you have OCD. You take this.
yeah, so I suppose, yeah, an obsession is almost like an intrusive thought, an unpleasant thought, a thought that you don't like being there, a thought that you want to make go away. It can be a thought, image, or impulse, as it says there. With myself, it'd be more kind of, you get a thought. We all get intrusive thoughts,
Mm.
but like, you could be walking down the street and you see a cat or something, you're like, you know what? I could kick that cat. And I'm like, that's a horrible thought. We are not our thoughts, but OCD in a way makes us think we are our thoughts. And we'll say, you can't kick that cat. That'd be a terrible thing to do. You must be a terrible person because you
Yeah.
believe that. And you could get really focused up on that thought and really distressed by that thought, to the point where you might want to do something to try and make that thought go away, which would be a compulsion, which will come in later. Um, Anything you want to flesh out there a bit, Leslie?
What I was going to say is we know from the research, and again, it's in Dr. Zed's book. I can't remember the name of it for adults. And researchers identified there's three mechanisms in the brain that are not doing what they're supposed to do. Hence, this is what's causing the OCD. And I call them sticky thoughts, and they just keep coming over and over again. There was research done in the 1970s by David or Donald Clark. I always forget which, but I think it's David Clark. And he gave typical OCD thoughts to 300 college kids. They had the same thoughts. What the difference is around interpretation. So Alex described a thought: I could kick a cat. I could have the same thought, but because I don't have OCD, I just go, ooh, not a nice thought. And it just fades away. It doesn't
Mm.
become a sticky thought. But for people with OCD, because of these three mechanisms in the brain, which are not working, and by the way, this is what medication and or the therapies we'll discuss help with, it becomes a thought that comes over and over and over again. And the more it comes, the more, people with OCD try and push it away, make it go away. And that's where the
Yeah.
rituals come in.
I remember hearing it as being told to me as like the pink elephant theory, which is the idea, don't think about a pink elephant.
Mm-hmm.
And it's all that you can think about because you're trying not to think about it. The same kind of mechanism works with these thoughts. You're trying to not think these thoughts, but because someone who doesn't have OCD doesn't really care, it's like, oh, that's a disgusting thought. Oh,
Yeah.
well, and moves on. They don't think about it as much. But with OCD, it's always in your mind because you're trying not to think it, and then you're trying to make it go away, and it's making you feel terrible.
And the thing is
Mm,
about intrusive thoughts, we all have them.
mm,
I'm laughing. I'm thinking about something I did recently where I really stuck my foot in it. And I was like, oh, it just keeps playing over and over and over in my head. And it's our brain's way of trying to remind us in a really screwy way of saying, don't make that mistake again.
mm. Yeah.
So intrusive images, thoughts, all these impulses, we all have them. It
Mm,
just, again, because of those mechanisms in the brain, which are a tad bit out of whack, and apologies here. It's going down a different pathway, and it's resulting in the OCD. And there's really cool studies where they did MRIs of brains pre-cognitive behavioral therapy, post-cognitive behavioral therapy with people with OCD, and you see differences in the brain activity. It's really, really cool. And so what we're realizing is the therapy, there's only two therapies, we'll talk more about it, that work. They create what's called neuroplasticity. And we're realizing the brain has a lot more flexibility than we ever realized, which I think is really cool.
mm. And also, like, important thing to note, people with OCD, just because they have these thoughts more doesn't mean they're more likely to act on them. You get people who are afraid that they might hurt somebody that they love. This has nothing to do with them actually wanting to do these things. In fact, from what I've heard from you, Leslie, is that they're actually less likely to hurt people, even though
Absolutely.
they have these thoughts more often than others.
I'm going to quote another expert from my field, David Veal. He's a psychiatrist, big name in the world of OCD and body dysmorphic disorder. And in his book, Overcoming OCD with Oh, I can't remember his name now. Yes, I'm doing well on the name front tonight. Um, David Veal says that he would love to have somebody who has a fear of being a pedophile, which is a type of OCD,
Yeah.
babysit his kids. And that's what the anxiety is. The anxiety is about I'm afraid I'm going to do something that is not who I want to be. And this is where Alex mentioned values, and their values are our moral compass. They're what keep us going. This is what guides and direct us through life. And OCD makes you behave in a way that's not in agreement with your values. So I will get teachers who love kids, or moms who love kids, who are afraid they're going to, take a knife and stab them. They're not going to. And believe it or not, the therapy is I bring in a set of knives to work and we play with the knives. Obviously, not to start with. But, and I've had people say, "Are you afraid they're going to harm you?" I'm like, no, they're never going to harm me, because people with OCD don't act on those thoughts. Because what happens is the OCD takes the very thing that you love and turns it on its head.
Mm.
And I refer to obsessions as brain farts, because that's all they are, hot smiley air, essentially.
Jeez. Yeah, that's a really great speech there. Went from knives to gaseous eruptions. Great. Um,
You're a great
um,
influence, Alex.
I know. But yeah, an important thing here as well. Most people realize when most people have OCD, they realize these thoughts are illogical. So you might think that, oh, because I don't wash my hands, my family might die. It's like you've washed your hands twice. There's nothing left. They know that at a certain level that the germs aren't really going to get there, but it's this kind of nagging feeling of, well, just in case, like you wouldn't want to kind of make it happen by, saying that you're not going to do it. Maybe you kind of want it to happen. No, no, you better do it again just in case. But that's more in the compulsion side. But that's kind of the obsessive thinking that kind of aids with the compulsions, which are much more visible a lot of that time.
And some common examples of obsessions
Yeah,
are fear of encountering dirty things. And I
yeah.
mean, even things which are obviously not dirty. Fear of doing harm to yourself or to others. Unwanted thoughts or mental images related to sex, fear of making a mistake, an excessive concern around morality, fear of doing things wrong, fear of doubt or disgust, excessive concern with sexual orientation or your gender identity, need for order, neatness, symmetry, perfection. By the way, that's David Beckham, for anybody who doesn't know that. He came out about his OCD a few years ago, which I think is fantastic. And a need for constant reassurance, which actually, I'm not
Mm.
sure, Alex, you might agree with me on this, why it's in the the obsessions part. I know it's a common thought, but I see it more in the ritual form, where asking for
Mm.
reassurance is the ritual, the compulsion.
Yeah, I would more see that more in the compulsion form. I'm not quite sure. One thing I did want to mention is like concern about gender identity and things like that. That's not in any way an attempt to bring in any kind of conversion ideas or an idea that that people aren't validly, transgender or something like this. The concern is more where you're becoming obsessed about the idea that you might be afraid that you are.
Yes.
You don't have to be. Many people, in fact, I think most people who get these thoughts don't usually have a problem with other people being like that. They're just
No,
afraid that that's
it's about
themselves.
themselves, very
And
much so.
yeah, it's not about kind of closing down those ideas.
No.
It's really just they're really confused about what they are, and they're getting obsessive thoughts about what they are and what that would mean for them. It's very much unrelated to how they actually view that.
Yes, very much so.
Um,
And it's
but
great. It's important to be aware of that distinction,
yeah.
um, because I've worked with people. It typically tends to be young men who might be afraid they're gay, although I had worked with a lesbian who was afraid she was straight. And again, this is about the value system. And the reality is, every one of them have been just incredibly open, generous, compassionate individuals. It was more about themselves.
Mm. Yeah, I just think that's important to note specifically here. But
Yes.
what's the difference between an obsession and a hyperfocus? And there is my cat Nemi. I am obsessed with my cats. I love them. They're great. Um, even we were talking about my cats before we came onto this presentation. Um, talking about my cats brings me joy. I love talking about them. I like seeing them. I like petting them and playing around with them. You could say I'm obsessed with my cats.
You are.
Um, yeah, I am. I know I am. But you could, and you'd be right. I am obsessed with my cats, but that's nothing to do with OCD. My obsession with my cats brings me joy. I'm not afraid of what will happen if I'm thinking about my cats. It doesn't bring me fear. The only fear I have might be losing them in some way, but that's different, very, very much different. OCD thoughts are all about things that will make you anxious. You're anxious with those thoughts. Those thoughts bring you fear, anxiety, and many other very unpleasant feelings. But with autism interests and special interests,
Yep.
you really get joy out of what you're doing. And if you're not getting joy out of it, sometimes you'd be like, you know what, maybe I'm just not that interested in this anymore. And that's okay too. But with OCD thoughts and obsessions, they are really, really distressing. They're
Yep.
distressing to do, they're distressing to think about, and that's why you're trying so hard to get away from them. But you're still doing them, bringing them back. But I think it's important to kind of know the difference between an obsession and an obsession that's to do with OCD. Like we have here that you could be obsessed with a new song and it's not impacting your life in a negative way. One thing that is important to note is that in some of the differences, they might point out that autism special interests might still get in the way of your life, but that's more that you're busy doing something you enjoy, that you're not able to go and do something else. Like maybe you're not able to go to bed on time to get up for school because you're enjoying playing your computer or something. That's not OCD, might impact your life, but it's not the same as I can't go to bed. I need to wash my hands another 30 times to make sure that's the number that I can sleep with. You know, that it's a very, very different situation. It's all about distress when it's OCD.
And we talk about in psychology, we go, what's the function of the behavior? And it's very formal language. And what we're really trying to communicate is what is the behavior, the action. Are you trying, is it bringing you joy or is it bringing you distress? And I'm thinking about a talk I went to years ago with a lovely gentleman who's a geologist, and he's an autistic individual, and he spoke about he would look at a rock and he just got lost in it for hours, and it was just fascinating to listen to him talk about what he could see in it, but he would forget to eat, or he might forget to hop in the shower. But he had such pleasure, which is why I'm smiling thinking about it, because it was wonderful to listen to him talking about it. Whereas with people with OCD, they are in, think back to that image Alex had with, the bully with the whip in the brain. That's what people with OCD are experiencing.
Mm.
And I think we all get obsessed with things here and there. But again, it's not something that brings us distress, unless, of course, our mom is yelling at us to get down for dinner and you're caught up doing something else. Then that's a little bit different.
Yeah, but it's very different. It's not distress coming from within or within your own mind. But let's see, what's the next slide now? Compulsions. So in the way that obsessions are thoughts that come into your mind, compulsions are the things we do to try and alleviate those thoughts, neutralize them, or make them go away. So in the same way that you might have an obsession, my hands are dirty, I might make my family sick. I use the hand washing example a lot because it's something people are familiar with, people know, and it's kind of easy to understand. But, you might be worried then, my hands are dirty. If I touch my family, they might get sick. The compulsion then is I'd better wash my hands repeatedly to make sure they are clean. And then I won't think about the fact that I'm going to make my family sick and I won't be worried about it and they're not going to be hurt.
And real
Compulsion.
quick, what Alex is hitting on, that theme about harm,
Mm,
at the end of the day, a lot of OCD, not like all of it, but the big bulk of it is about trying to prevent harm to self and others.
mm,
And years ago, OCD Ireland had an International OCD Week, and we referred to OCD as the worst superpower because, in a weird way, everybody's kind of a superhero because they're wearing the red cape trying to protect everybody. But people with OCD then are Clark Kent during the day. They're trying to disguise it, they're trying to lead normal lives, but people don't realize what's happening in the background and what they're
mm.
trying to avoid to protect everybody else.
Yeah, I can't wait for DC's new movie, OCD Man. Um, but yeah, the compulsions, they're unpleasant. They take up a huge amount of time. They're they can be really damaging to your physical health as well. Like, you know, hands can bleed and things like that. It gets in the way of life, you might want to, it gets in the way of things that you want to do. Like even if I wanted to go to college or visit a relative in hospital, the compulsions don't wait. You need
Yep.
to get them done. And they can be, in a way, cyclical. They never end properly. You always have to kind of rip yourself away from them, which is just a constant trauma that you live day after day after day. That really can, it's amazing just how you can even get through it. Um,
And I was gonna say for the family members, I once remember reading in a book about a family living in California, and they had lots of water restrictions, which would be common in California. And the son had contamination OCD. So not only was he hand washing, but he was hopping in the shower, he was washing his clothes, he was washing everything. And they had severe water restrictions. So the fines were significant. It had gotten to the point that the family put a padlock on the washing machine to prevent him from using it.
uh,
And the kid took bolt cutters and took it off in order, his OCD was so severe and they didn't
yeah,
realize he had it. They took bolt cutters and took the lock off. His dad punched him. And
uh,
the case study was just heartbreaking, but it really illustrated one, the family needed psychoeducation. They needed a diagnosis.
yeah,
They didn't
yeah,
understand. But especially with kids and teens, families can get very pulled in, but
yeah.
also
Oh,
that
yeah,
that logic bit, like the kid knew the family was getting fines, the kid knew there were water restrictions.
yeah.
The OCD, Alex said, it feels the thoughts feel so real.
There,
That's the
there's few
difficulty.
things in my life I've witnessed that are so powerful. In fact, I don't know that I have witnessed things so powerful as OCD trying to get its fix. When you don't understand what's going on and you're working with the OCD, it will make you do anything to get it done.
Yep.
The things that I've even done personally, I look back on in shame, um, that I have done in my own life, and the people I've hurt trying to fulfill my compulsions. It's really hard to go through it, even though I know myself that, I didn't have the tools I needed to be able
Yep.
to challenge that. It's something that, unless you're there and unless you see it, it's so hard to believe just how powerful the drive is to go and do something when it's not getting fulfilled, when it's being taken away from you.
And it's important to remember it's your OCD. Like my mom has Alzheimer's, and my
Mm,
sister and I, my sister's brilliant because we have to remind each other it's not mom, it's her Alzheimer's,
yeah.
when something happens. So it's not Alex in this case, Alex, just because you're talking about it,
Yeah, I know.
it's his OCD. And I think that making that distinction, it's not take somebody off the hook, it's create context and compassion and understand.
It helps me to understand what OCD wants for me and what I want for me
Mhm.
in separating myself from the OCD, because I can say, I don't want the answer to this question from you, Leslie. I don't want you to tell me today is going to go great. OCD wants you to tell me today is going to go great. It's that kind of idea that, you know, I can divide myself from it so I know what it is that I want versus what OCD wants. And I suppose that's another important thing to mention is just reassurance seeking behavior, which I find is a bit more difficult to kind of figure out, which is the idea that, you're trying to, like, oftentimes, like when I had contamination OCD, I would get my mother to clean something for me, and then I would interrogate her as to how clean it was. This was an attempt to try and make things easier on me so I wouldn't have to clean it and get distressed. But then you're then seeking reassurance from her to make sure it was cleaned properly. That's another compulsion that can be brought in that would definitely impact families a lot. And it can be incredibly frustrating for those family members because at least the person with OCD has some level of understanding of what's going on sometimes,
Yeah.
but the person who's engaged with it often can get very annoyed thinking that, why are you
Alex, I
making me
don't
do
know if
this?
you're frozen for anybody else, but you are for me. Well, Alex is going to unfreeze.
Fortunately, I think it's Leslie who's frozen.
Oh, I was being quiet because I
Disorder.
thought it was me being frozen.
No.
Oh,
Oop.
Sorry, Leslie, I think it was you that your connection went, not ours, and I
Okay,
just stayed
cool.
quiet. Never mind,
Okay.
never mind. This is the
Okay, well,
with
price.
I'm
an
going to take
outside force, both of you are now back. So
thank
we're all
you.
good.
This
Sorry.
we're putting the
Um,
web in webinar.
Well, real quick, there was what I was going to, Alex, I thought you were frozen. There was a question asking, do you know if a large number of people with personality disorder suffer from OCD? It sounds very overlapping. There is an OCPD is what it's called. It's an OCD personality disorder. It's a bit different. I'm not au fait with it, so I really can't talk about it. Apologies, but there is a OCD personality disorder. Bipolar is quite different. That's more marked by the highs and lows of the moods. I know that when people are in mania and a high, they can be quite compulsive. But it would be different. It's not about trying to make thoughts go away. My understanding, and I don't work with bipolar, so my knowledge is limited. A lot of the compulsive behavior would be risk-taking behavior, gambling, extramarital affairs, drinking too much, drugs, things like that. So with OCD, there's a very set patch of thoughts. And we do have a link to that in the notes. It's very easy to categorize what is OCD. And it is actually different. I hope I've answered your question. Alex, we should move on.
Yes, we should. Okay, just going to go back just to name I think we should name the common compulsions and then we can move on to
arranging. Well, the next slide Alex had was arranging things. Autism boy, I think, as you referred to him. I love the picture. This picture here is really good because we captured two different rituals. We have an internal one of counting, with the external one of hand washing. So we've got the bathing and cleaning, collecting and hoarding things that have no value. But again, I'm not as comfortable adding that into this list, but that is what the research is telling us at the moment.
No, there are compulsions around. I have compulsions around keeping objects myself.
Okay, cool. I'm glad you're making that distinction because I always my brain goes automatically to hoarding, which is separate. Then we have checking things. Could be light switches. It could be stoves, taps. Checking that you haven't caused harm. That's a really common one. And again, that constantly seeking reassurance. There are rituals attached to numbers, such as counting, doing tasks I mentioned, saying certain words. Prayers are really common. That's called scrupulosity when religion's involved. And that can be any religion. And also a compulsion to avoid things that might trigger your obsession would be very common.
Yeah. I just think it's important to name those because people need to know the variety. Okay, next. Yes, this is what's known in parts of the community as Autism Boy. He was on the Wikipedia article for autism for a very long time, and he's sadly missed from it now. He's stacking cans and he's having a great time. But this is kind of to highlight the difference between OCD compulsions, I suppose, versus autism rituals. And that is that this kid seems to be having a great time. He's stacking cans. I wish I could do it with him. He's concentrating, he's building up motor skills. It's fantastic. He doesn't have to do this because he's afraid someone's going to be hurt. He doesn't have to do this because he's afraid of what might happen or how he'll feel. He's doing this because he likes it and he's living his best life stacking cans, unless he dents them, in which case you shouldn't eat a dented can, so I believe. Or don't eat any can unless you're a goat. But yeah, it's all about kind of context. Are they feeling distressed? Are you feeling distressed? Or are you enjoying what you're doing? There's many autistic kids I've heard about. They love lining up things. My sister used to love lining up animals and stuff like that. She enjoyed it. This was her play activity. There was nothing wrong with it. There was nothing distressing about it. It was not OCD in any way. They're just playing and learning in their own way, I suppose. Also, you can do unpleasant, repetitive tasks if you're trying to learn a skill. But again, this isn't because you're afraid something terrible is going to happen if you don't do it this way and this many times. And, you know, we have here as well, if you're working in a library and you're stacking books all day, you know, makes sense. That's not necessarily compulsion. It could be, but probably not. Shall we move on to the next slide?
Please.
Cool. So yes, I like this one. There are some similarities between autism and OCD. I was told about an example of someone who's autistic and I believe had an intellectual disability. And he would flick on and off the light switch repeatedly. Now that could be checking switches to make sure it was off, but the person who I was speaking to learned that this person was actually doing this because they were overwhelmed. And by flicking on and off the switch, they were getting sensory input that helped them regulate their emotions and help them feel better by having the light flash on and off with the switch that they were flicking. In this way, that's nothing to do with OCD. They were trying to regulate their emotions. They were trying to calm themselves down. They weren't doing it because they were afraid something was going to happen. If you stopped them, they would be distressed. In a similar way with OCD, you'd be distressed if you were stopped doing a ritual, incredibly distressed. But this person trying to soothe themselves, they'll be distressed for that. But the goal of what they're doing is different, and how they feel when they're doing it is different. They're going to feel as if they're still overwhelmed, but this is calming them, and they'll be able to understand that being calmed. In this case, with intellectual disability, I think there was a gap in understanding, and this person was flicking the light switch, helping to calm and regulate their emotions. OCD would have been, I have to check this, or else anxiety would have been raising, not lowering. Do you have anything else to add to that one, Leslie?
Well, I was going to say I had a client that used to do light switches, and he did it to prevent I forget what it was, something bad happening. I can't remember exactly what it was.
Always something bad happening.
Yeah, it's always something bad. And so again, that purpose of the behavior for him, it wasn't pleasure. There was no regulating. What he was trying to do was appease the OCD thoughts that were coming in order to give himself short-term relief, because that's all it is. It's never long-term relief.
It never is. And even then, the short-term relief is very, very minor. It's basically just enough short-term relief to make you stop doing the ritual until you have to do it the next time.
And he used to sometimes come back. He would
Which
leave,
is why that happens.
He would get out the door, walk down the road, come back, rebuzz me, which I knew. And he would come in and he'd have to do the light switches again, which was completely okay. We had no problem with that. It was one of the behaviors we targeted later on.
Yeah, it's important to know flicking a light switch in this example can appear to be an OCD behavior, or can appear to be an OCD or an autism trait, but it's about kind of trying to figure out the reasoning. And people generally, in the case of intellectual disability, in this particular example, the people who worked closest with this individual would know the signs of this person being distressed or not. And in that way, you're able to figure out if it's an OCD ritual or not.
And something, Alex, if you go to the next slide.
Yeah, of course.
I'm just conscious of time here, but
no, of course.
There's a question about how many people get OCD. And so, sorry, I got excited when I saw it because I knew it was our next slide.
Well, don't worry, we have the Q&A at the end too, so we can get to questions
I know
afterwards.
We do. By the way, if you haven't noticed, Alex runs the show.
Always.
Absolutely. I have it no other way. But OCD, it's really interesting. As the statistic here says, it affects men, women, children of all races, ethnicities, and backgrounds. There's no favorites here.
Although I think it typically doesn't occur in children below the age of 12, is that right?
No, it does.
It does. Okay.
Yeah, absolutely. It does.
Okay.
And that's the whole thing. When I forget the statistic, and I think I have it somewhere in my own notes. When it hits a child, you're looking at a higher probability of a genetic link that other family members have it. Clients of mine are frequently described having anxiety in early childhood, and then it becoming more OCD-like as time went on. And what's kind of interesting about OCD is it's extraordinarily rare to develop OCD after the age of 40. I do not know any other disorder that's like that. So OCD has many unique features. And I was speaking to a psychiatrist a couple of years ago. They brought in 3D MRIs, and he said he saw an MRI that was done on somebody who has OCD. And I said, what did you see? He said, there's an awful lot of strange things going on in there. So we know far more than we used to, but there's a long way to go as well in that regard. And I remember also reading a study about EKG waves, and they were saying in other disorders there's overlaps, but OCD, the graphs that were coming up for that, they were completely unique to OCD. So it's quite interesting. As the technology gets more and more sophisticated on all fronts, we're going to learn more and more, which is going to aid treatment, medication, and all sorts of things. But they reckon. And this is the problem. The research has been looking at genetics. And I know personally, my own practice, the vast majority of people I work with, there's OCD somewhere else in the family, or trichotillomania, the hair pulling one where people pull their hair out. And if it's not OCD, there's typically a psychiatric disorder in the generation above, the layer above. they just don't know. Every time they think they've come close to finding the genetic marker, Johns Hopkins was the last one to put out an announcement, and they withdrew it a few months later. So it's very elusive. It's hiding. But at some point they will find it. The thing about OCD to remember as well, I always feel really awful when I say this to clients, and I feel awful even saying it now for anybody who may not know. OCD is for life. Like with depression, you may have a depressive episode. I did in my 30s. I've never had another one. I got therapy, and I did, what was necessary to take care of myself. And I work hard at my own, keep my own mental health going. And so there's some disorders that will come and go. OCD can fluctuate. It can go up and down. You may have more severe periods. I find warning periods for OCD, times of stress, lack of sleep, hunger, hangover, and boredom. That's when I find typical spike times. But I did see a question that popped up here, and it was, does OCD happen on a spectrum of mild to severe? And absolutely. And somebody may even experience that spectrum in a lifetime. Most of the people I've worked with, and again, this is anecdotal, this is not research, this is my personal experience, their OCD stays at a pretty steady rate for their lifetime. Although, as an aside, they're now looking at menopause. And I've seen it now in my own practice, that in the perimenopause and the menopause, because of the hormone fluctuations, OCD can spike. And then unfortunately for some women in pregnancy, I think it's around 11% of the cases with women. So it's not common. They develop what's called maternal OCD. And as a result of the pregnancy, I'm not sure why, I can't give you the medical reasons, they develop OCD, and it doesn't go away after the pregnancy. So it's quite unfortunate. I've had a few women come through my practice over the years who had been pregnant and developed OCD. It was quite a shock to what was supposed to be this joyous time where you're suddenly dealing with intrusive thoughts and doing rituals.
Yeah. I've heard of that happening. Before. Sure,
now there's speculation about strep throat. They call it pandas, and this is.
I remember hearing about pandas. Was this kind of an infection that could cause it and then could be treated through antibiotics, but it seemed to be extraordinarily rare.
Yeah, and again, it didn't go away. And this illustrates we know so much more than we used to, even from when I originally trained. The leaps and bounds, but unfortunately, we still have a lot of gray areas. As time goes on, we're going to keep learning. And I'm just going to put in that flag already that, the deep dive in research that Alex and I've done over the last couple of months, what was really discouraging was to discover a lot of the research that's been done about OCD and autism, they're now realizing was flawed research. So the statistics are quite woolly, and I'm going to apologize again for that for my profession. The reality is, it's the really popular disorders that have gotten a lot of attention. With the pharmaceutical companies, they love the disorders that make them money. So for example, there's a type of bipolar disorder that's uncommon, and the medication options are really limited there because they're not going to make money. So I'm hoping as time goes on and as our awareness grows, that we will start looking at these areas a lot more succinctly and comprehensively in order to provide the appropriate help that's deserved for everybody.
Okay, we're getting low on time, Leslie. I think we need to
sorry.
move on to the next.
This is typical of Alex and I. Sorry.
Yep. Okay, so intellectual disabilities, autism, and OCD. That's you, Leslie, I think.
Yeah, unfortunately, we just don't have a lot of information. Now, Alex really highlighted something really well earlier with the light switch. Part of it is because some kids and adults are nonverbal with intellectual disabilities. So it's about that information gathering and understanding. And that's why having, an OT, the psychologist involved, the doctors, whoever the team is, who really know the individual is really important, because they will know the telling signs of when somebody, is trying to communicate something. But there's also, again, a lot of overlap. We have repetitive behaviors for OCD, repetitive behaviors for intellectual disabilities, and we have repetitive behaviors for autism. And with the intellectual disabilities, they're struggling to figure out where everything belongs. So there's some barriers there.
Yeah, unfortunately, we don't have the expertise to speak to intellectual disability in here, but I did want to mention it because I know that it's a big crossover in our community, and it does occur in individuals with intellectual disability, and it is distressing. And it would be most important to find someone who specializes with that to get that treated properly. I imagine it would be still quite similar treatment ways, but would be adapted to intellectual disability rather than it being a totally new method.
Yeah.
But that's only my intuition on it. So we'll move on to the next slide, which is diagnosis and treatment, the best part, in a way, because it's the least bleak. Yeah.
It is. It's about hope. And the graph we're looking at is the treatment of OCD. There are two therapeutic models that work. One, most people have heard about, cognitive behavioral therapy. We call it CBT. The other one is called acceptance and commitment therapy. It's a new kid in the block. It was only developed in the 1990s. The research that's coming out, in particular around OCD and anxiety, it's really promising. It's a therapy I prefer. And so what this graph is showing us is the first time that you face your OCD. So perhaps it's a dirty doorknob. So the first time you face that dirty doorknob, your anxiety is going to be sky high, or the doorknob you perceive as being dirty. Second time you do it, the anxiety starts to go down. Third time, it starts to go down. Fourth time, it goes down even more. And so that is the therapy. The acronym for fear is face everything and remain. And that is what you have to do, even though your brain's saying, run away, make it go away. I don't want to do this. You have to face it. And that's what's really crucial.
Yeah. So yeah, the ERP or CBT as well, just to mention as well, many people, don't like the idea of CBT being used around autism. That's a fair criticism.
Yep.
But what we're referring to here is CBT being used solely focused on the OCD with a neuroaffirmative psychologist
Yep.
that is aware autism traits aren't symptoms to be treated. OCD symptoms are, and only with the consent of the person dealing with the psychologist. This is the way that OCD is treated. I got CBT and a mix of ACT, I think, or ACT rather. I know.
Break that habit of you.
I said it before you did. Yeah, ACT is, I got a mix of those two to treat my own OCD. I found that very useful. But I have a psychologist who's very much neuroaffirmative. That's been helpful for me. But ERP, very, very much a simple concept. Same way you'd think of dealing with a fear, like if you had a fear of spiders, you look at this picture of a spider, you look at a small spider, you go to the zoo to see tarantulas. You graduate yourself up to things you're more and more afraid of as you get more and more used to it. Most important part there is the RP, so it's exposure response prevention. So you have to expose yourself and prevent the response. So in my case, when I had contamination OCD around it, I could touch something dirty. I had to touch a piece of cat food that I perceived to be dirty. So I'd touch a piece of cat food, rub it on my hands, rub it all over my hands, and then put it down, and then go about my day. I wasn't allowed to wait half an hour and wash my hands. That's not how it works. I'm not allowed to go and ask my friends or my family to say, cat food, I'd be safe touching cat food, wouldn't I? Can't do any of that. You have to just sit with the discomfort. You can distract yourself by going and doing something. Once that distraction doesn't become another compulsion, doesn't become another crutch, you can still just go about your day as if you're doing everything else. And then the theory is the anxiety will go down. And if you're not doing any safety behaviors or behaviors that are still OCD behaviors, your anxiety should indeed go down over time. Now, again, it'll be really high and it'll stay high for a considerable length of time. It will be distressing. It will be difficult. You can start off very small. That's the best way to do it. Start small and grow up. You get up there until eventually you're up there watching people putting their hands in toilets. But don't even think about that when you're going at first. Just think about the small things that could make a difference to your life. If you're not able to touch a doorknob, maybe you'll be able to open doors. That'll be a freedom. That'll be something you can claw back from OCD. And you do it repeatedly until eventually you're comfortable with it. You can move on to the next thing. You can then rank your stress, and you'll see over time. And over time, after doing this long enough, what you do is you train your own mind. It's like learning a new skill. You train your own brain to be able to spot OCD and to be able to spot the behaviors that are involved with OCD that will keep the anxiety alive. And you become much, much better at it yourself. And that's how you manage it as you throughout your life. That's how you manage OCD, is by learning the skill in how to deal with OCD. that's what you do. You can manage it throughout life
You become your own therapist. And the thing that I
in a
just
way.
realized, Alex, that we forgot to do, ERP is also part of the acceptance and commitment therapy model. Both are behavioral based models. So it's very much based on action. And the reason, just real quick, we have the nice guidelines is because they're in the UK and all they are guidelines, but they take a couple years to be put together. They get a panel of experts in particular areas. They review all the research, the good, the bad, the ugly. And from that research, they put together guidelines to help professionals. And they have medical stuff, they have mental health stuff, but the nice guidelines for the treatment of OCD for people, for autistic individuals, is to tailor the treatment for that particular individual. And they're starting to get better at figuring out what that looks like. For some people, medication is an option. I know it's not for everybody for different reasons, but just a flag, it's the SSRI family.
Yeah,
Alex,
so it's just basic antidepressants,
yeah.
and they're more there to grease the wheels, make your anxiety a bit lower in general. You'll typically get a higher dose of the antidepressants. You don't need them to do it. It's just something that can often help to push.
Well,
the
Alex,
process.
actually, there's therapeutic doses for SSRIs. They're well documented.
Oh, well, look,
So the
don't
OCD
mind what I
Foundation, the
say.
International OCD Foundation has a great graph that tells you what the therapeutic dose is for each medication for OCD.
Well, it's higher than for depression is what I meant.
No, it's not.
Oh, look, whatever.
No,
I need to
sorry on
talk to
that one.
somebody then.
Let's go to the next slide.
Yes. There we are. So what do you do if if you suspect that you or someone else has OCD? So first thing, get assessed. Find out, do you have OCD? Do you have it for definite? Then,
And by the way, there are some great, like the International OCD Foundation, OCD, OCD Action, apologies, tongue-tied. They will have self-tests. There'll be organizations that will have self-tests, not for diagnostic purposes, but to help you decide, do I need to go get a referral? Do I need to get assessed by someone?
so then we've kind of covered a lot of these: support groups, books, podcasts, support organizations, all useful to get a better knowledge of OCD and your own OCD, which can be really useful. Being able to try and put words to your feelings and how you've been feeling about it, find very useful at times.
Oh, this is in the notes that'll be sent out with the slide.
Yes. How to help an autistic kid or teen. This is very important. You need to be a part of the therapy. When I was young and had OCD, my parents were trying to combat my OCD without doing it through me. They were trying their best. It was definitely not the right way to do it. It has to come from the person themselves, even if they're children. They have to have an understanding that they're the ones going along it. Otherwise, OCD will perceive it as a threat and they will be fighting you all the way. And it will just end up causing rifts between you. It's vitally important that OCD treatment comes from the person, or is at least directed and led by the person. You can assist them, you can help them through it, but it needs to be done in collaboration, not the treatment isn't like a medicine where you can force it down their throat in a sense if they really need it. That will not help. It will not work. It has to be done with them and through them.
And also with the schools need to be part of this as well. And it's not uncommon for kids to be able to kind of to hide, to not do their OCD in school and things like that. And when they come home, they let it all hang out and the OCD really flares up. And I know parents can find that confusing, go, wait, they're doing okay at school, why they're not doing it at home. It takes a lot of energy for them to do that. And when they're at home, they're comfortable, they feel safe. And that's why it's appearing there. So it's not that kids are doing it to be deliberately bad or anything like that. But it's the communication piece and psychoeducation piece is really essential. And that's why I think support groups for family and friends can be really helpful too.
Yeah, I think we have a bit more of that on the next slide. Yeah, where family and friends for teens and adults this time, sometimes online groups and stuff like that can be really useful. I didn't do them myself, but then again, I had a family who had experienced it. So in a way, I had someone to talk to about it. And that was useful to have someone that kind of gets it when you're like, oh, you know what it's like when you're doing this and then this happens. And they're like, yeah, just that can be quite helpful at times.
And the moderated boards are kind of a bugbear of mine because the moderators are there frequently, other users who've done training and are approved, and they're there to protect everybody. When the boards are unmoderated, it can be a little bit nutty in there, and inappropriate stuff happens. So I'm always about look for the moderated boards. Again, this is in our notes. We have selection between the UK and Ireland, and actually an American group, not because I'm American. They're good. They have lots of money behind them. So we have some options in there for you on a number of areas.
Right. And then we have how to help someone. So yeah, self-help techniques. So self-soothing techniques. You can help people through them. Become aware of triggers, just so you know when someone's could get overwhelmed or upset, and they might be lashing out, but it's not them trying to hurt anybody. Work on communication skills. Now, this is more about being able to, there can be autistic people sometimes can find it more difficult to articulate feelings and thoughts. Even neurotypical people with OCD, if they're neurotypical at all, can find it difficult. But it's very important to be able to communicate clearly about your feelings with OCD, what your thoughts are. It helps you understand them yourself, so you're better able to take them apart, better able to challenge them. It's something that you just get a bit of practice on, can be quite useful. Yeah, and talk through transitions and changes, why people are going to places, why, or what's going on and why. Simple enough.
When working, if the person who has OCD, the autistic person has OCD, is working with a therapist, I love bringing family members in and that we discuss these things collaboratively and that there's buy-in from everybody, and even setting up contracts. Because as I say to family members, they're the coaches, they're there. I'm not. And they're having them understand what we're up to and why we're doing, and having them read resources is just absolutely essential. Everybody, this OCD doesn't just impact the person who has it, it impacts everybody around them. And that's why it's important everybody educates themselves in as much as you can.
Yeah, it can be incredibly distressing for families to deal with OCD. Even me dealing with another family member with OCD can be incredibly distressing for me. And I had it. I get it more than anybody, but still I get annoyed. So it's something that, can be difficult, but is important to be aware of. So yeah, it's very important to know when these people are doing these rituals and they impact your life, they're not doing it to you on purpose. They don't want to do it. They want to do it less than you want them to do it. They really, really, really don't want to be doing these things, but they're doing it because they think they need to make sure to keep people safe and make sure something terrible doesn't happen. This is true of children, teens, adults. They're not doing it to hurt you. They're not doing it to upset you.
They're actually doing it to protect you. And that's why
It's horrible.
the worst superpower there is.
Yeah, but OC is telling people this has to happen or else. Not
Bad things.
Yeah. OCD is very much like that, or else. Not a nice thing.
Schoolyard bully.
So we've come to the end of the presentation fully within 2 minutes of the time, which I think was excellent timing.
But again, in our notes, I mean, what we've done is what I'm going to call the whistle stop tour. We've given you the highlights, and Alex and I felt it was really important that you guys had more information available, and also to see where we found our information. So it's about 16 pages of notes. Who's the obsessive one here?
Look, it's good stuff, and I like that it's there. It's a resource. If you need it, you can go and look at it. Whatever you need might be there. If you didn't understand something, it's there. It should be. It's really good. There's some good resources there. A really good guide on the difference between an OCD behavior and an autism behavior, or an autism behavior. Yeah, can be really important. I read through it. I worked on the notes with Leslie. Really important, really good way of trying to discern the difference between the behaviors, if that's what you're struggling to figure out.
Yeah. We made a chart to keep it as simple as possible. And just real quick, I know somebody asked if OCD happens, can fluctuate during a lifetime, and about the spectrum. Absolutely. As I said earlier, for me, most of my clients have stayed steady. Every once in a while, I've had a client where it even disappeared for a couple of years and then reappeared. So it can wax and wane. But the 5 times where I find OCD sneaky and sneaks in the back door, boredom, hunger, hangovers, stress, and tiredness. Those are the ones where I find we can be quite vulnerable to it. Sorry, I'm looking at the questions.
Well,
So,
I think, Bridget, do you want to read out the questions to us and
sure.
we'll answer them as we go, or just yeah.
I will say before I get into the questions that, like Alex, I'm also autistic and I also have OCD.
Mm.
I would say to the question about the fluctuation of severity that I do feel that my OCD can sometimes almost vanish. I do think that it's very mild generally for myself, but I have had periods specifically to almost year-long separate periods where I get into a really intense thought spiral that becomes absolutely debilitating. So it
Yeah.
is something that can shift and change over a lifetime.
Yeah, yeah, definitely. And I think it does accompany periods that Leslie was saying, like in periods of intense stress, it can just, there it is. Then it kind of becomes self-fulfilling. It fulfills its own requirement by being stressful enough to keep itself
Mm.
there.
I know just after a thought spiral, I managed to get out of a thought spiral. The next thought spiral becomes what happens when a thought spiral starts again.
Yeah, yeah. OCD is insidious and clever,
Yeah.
and
Just
can, yeah,
just
of
a
course.
question about the notes. I will be sending out the notes slides recording in a mass mailer tomorrow, so you will have that tomorrow. Go ahead, Alex.
No,
I
I,
was
I,
say,
I was done.
see, Aoife Madden asked, can you have OCD in childhood and then lose it entirely in adulthood? Yeah, it's rare. I've only seen it happen once in my entire career. But yeah, it can. And this is what I'm saying. We don't know why. It's really strange. And again, no other disorder has the age of 40 as the cutoff, but OCD does. So it's kind of peculiar and quirky in its own way.
One question was whether it's difficult to phrase, but whether a child can use what they a compulsion as a way to lash out. And I know from my own experience, an example of this could be I had a compulsion around, I had to set the table as a kid, and we had a set of green napkins and a set of black napkins. And I knew that I couldn't have the black napkins or I'd have bad things happen. Like it was very young, so it was still like the schoolyard bully thing of or else. So
Yeah, of
when
course.
I was particularly mad at one of my parents or my sibling, I'd give them the black napkin.
Ooh, talk about communication. Yeah, it can happen, you know. Um, and that's where working with a team can be really informative in understanding these things and teaching the child alternative methods to communicate, but also how to, look at their feelings, understand their feelings, and how to manage them. I do love those Pixar films. Is it called Inside Out? Am I
Yeah,
remembering the name right? Oh my God, I saw the first one. I have to see the second one. A friend of mine was just
he
talking about.
does get anxiety in the second one.
Oh, very good. Well, believe it or not, the consultant on, I know the first one, I'm not sure, I'm going to guess the same on the second, was an acceptance and commitment therapist. So it's very much an ACT perspective about learning how to accept the thoughts, learning how to accept what you feel. You don't have to like them. I want to be really clear. Um, but that, we develop a different relationship with them.
So what kind of questions do we have in the chat for this?
One is, I think, one that the research doesn't have a direct answer for, but is there a specific percentage of autistic people who have OCD or people who
We
have OCD who
know
don't?
it's common, but I'm not even going to, if the statistic is mad, I'll look for it. Go to another question, Alex, and I'll look. I have that, believe it or not.
Yeah, I think we do have it
Oh,
somewhere.
I do. I do. I know they say, sorry, it's
Oh, there we
estimated
are.
around 1 in 200 kids and teens in
Oh,
America.
no, I have it. Research from 2015 found that 17% of autistic people also had OCD. So 17% was one thing, and then 25% in another study. So a lot.
Something around there.
Yeah.
Non-negligible.
Yeah,
Here's the
significant.
problem, though. I mean, studies are based on people who come forward. And I remember when I
Oh,
was teaching what used to be DIT, Dublin Institute of Technology, and I had a student who had been missing class, and he finally came to me and explained he had OCD and contamination OCD. When I was chatting to him, there were multiple family members, not just in his own family, but extended family. Nobody had been for treatment. And it always made me wonder, how accurate are the statistics
Yeah.
if people are not going forward for the treatment? Because that's what we're looking for, that those people, to count them, to figure out how many people actually get it. So a lot of estimates you're going to notice are these wide ranges, 17 to 25%. That's a big range.
well, it's actually 17 to 37% now in the
Oh,
thing that we said. So it's a wide enough range. Yeah.
Yeah.
so
Okay. Do we have any other questions? Let's see.
so another one that's kind of difficult to phrase, as I think this can happen with a lot of obsessions, but is there any different way of treating an obsession when it begins as something that's like a big rational fear? Like if a person in the family is uh, going through chemo and there is more of a concern about infection, or
OCD loves
it
that.
become more common with the rise in understanding about global warming, where like a person might have an obsession about their carbon footprint, and that is important and it is a genuine fear, but
Well,
then it becomes
I think something I like to point out is that until the 1800s, we didn't know germs caused illness.
Mm,
Whereas you might have had contamination to a certain degree. People before that, people didn't know that was a thing. So I don't imagine that you had many people thinking, if I don't wash my hands, my family's going to get sick, when doctors didn't know that.
yeah,
In the context of this one, it's really common
Yeah.
for a life event to happen, for the OCD to link into it. And it's stressful, especially if you have a family member undergoing chemo and you suddenly have another family member, whether it be an adult, a teen, or a child, whose OCD is now latched onto that.
yeah,
It's a double stressor. And that's where forgive me, but get into treatment ASAP, to start looking at how to manage this in a slightly different way, collaboratively. And that's the problem with OCD. It's so insidious. It will take absolutely real life events happening. I
Yeah.
remember I had a client who was so excited. His sister had a baby. He was an uncle. He was just thrilled. And our next session, he came in and said, I'm a pedophile. And it was heartbreaking. He wouldn't see the baby. No, he beat it. Trust me, he absolutely learned how to manage that one. And I can only imagine what an amazing uncle he is to this day. And so that's what OCD does. It takes real life things. The pandemic, I have to tell you, I
Yeah.
was lucky that I was considered frontline staff, even though I have a private practice. And so I was working with clients in parks, particularly parks all over the city. But the contamination stuff was just huge, absolutely huge, because of the pandemic. So OCD often mirrors what's happening around us. So I know, like in the 1990s, I'm here for 30 years. I had a lot of clients because of the HIV epidemic, because Dublin, Ireland was starting to become, okay with people being gay. I mean, it's so strange to say that in today's day and time. And so as a result, there were a lot of people worried about having HIV, and a lot of young people presenting with the fear of being gay, or things like that. And when in fact it was OCD. There's a good question about the determining factor, whether compulsions relate to OCD or autism. And really, it's about, how do you feel? OCD, you're not going to be a happy camper. You're going to be doing everything you can to make that thought go away. And that's what the action is. With autism, Alex put it so well, with the light switch example. It is something that's self-soothing. In the particular case that Alex described, it was going to be regulating. One thing that we haven't talked about, and I'm thinking about the film The Aviator, which was really the first time we saw OCD properly depicted on the big screen. And there's a great scene where Leonardo DiCaprio's in the loo, and somebody interrupts him Somebody wants him to give him a towel. It's not described well, but this guy wants him to give him a towel as he's using soap that he brought himself to wash his fingers in a very particular way. And what the average person doesn't recognize, I did, anybody with OCD would, is that if he stopped, he'd have to start the ritual all over again. Whereas what Alex was describing, if this young man who was doing the light switch for self soothing, to regulate his mood, if he was interrupted, he wouldn't be a real happy camper, but it wouldn't be the level of distress that's caused by OCD. And again, with OCD, you're trying to prevent bad things from happening. It's not the frustration of, I'm not done. I want to keep doing this. It makes me feel good.
Do we have more questions, Bridget?
Yeah, we might do, technically supposed to stop at 1:15, so I might do one or two more and
Okay.
then we can call it a night. Okay. That's an interesting one. I'm gonna do that 1 second. Is there, oh no, there are a couple good ones. Uh-oh.
Good audience then.
Yeah.
Yeah.
Is there a noticeable buildup in especially circumstances where the functionality can change or the severity can change, or there are these very intense thought spirals? Is there a buildup to this, or is it like flash flood almost? Like the thought spiral is here at the level that it is at.
You're not going to like my answer. Everybody's different. Sorry.
Okay.
There is no general rule of thumb. As you asked the question, I had different people in each category popping into my head.
I suppose that answers the question.
Yeah.
It's unique.
Both. Yes.
Sorry.
Is there any overlap between OCD and what is sometimes an eating disorder like ARFID and is sometimes sensory eating, of what foods are safe and what foods aren't safe?
I think
Orthorexia is what that sounds like. I'm guessing. It's not recognized in psychiatry yet in the DSM. Orthorexia, if I'm pronouncing it correctly, can look like OCD, but it is not. It's more of an eating disorder, my understanding.
I think I'm not sure if they might be asking about the things that they particularly find disgusting textures, as someone with OCD. And what I will say is that OCD will latch on to anything else that happens to be different about you, whatever different neurotypes, other mental disorders that you might have, physical disorders. It will latch on to that. I'm lactose intolerant and cannot stand the sight of milk. I can't touch milk. I can't look at milk. I can't smell milk. OCD is very, very interested in that whole process and will make sure that if something has milk in it, I won't be touching it. So I now have a disgusting contamination around milk because I'm lactose intolerant. In the same way, if you have autism and you dislike certain textures of food, it might put you off from touching that food even with your fingers. It might stop you from opening the fridge when it's in there. I know someone who really, really hates oranges and will not go anywhere near anything that's even flavored orange. It will latch on to anything else. ADHD as well, autism, lactose intolerance. If it feels such a way, it will go for anything.
Yeah. I know myself, my first terrible thought spiral, I was 10, so pre-12.
Nice.
I was terrified of being poisoned, of food being contaminated specifically. My parents didn't quite understand. I didn't communicate it very well. I was an autistic 10-year-old. But they thought that I actually thought that people were purposefully trying to poison me. But I didn't. But that changed the way that I ate quite a lot. I particularly remember we went to a buffet at one point and I would only eat the foods that my mom also ate. And part of me rationalized that as like, no one's like she's not going to get poisoned. I'm going to get poisoned, but also if I'm going to get poisoned, at least I'm going to get poisoned with my mom.
Yeah, that the thoughts patterns don't make a lot of sense
They
sometimes,
make a lot
but
of sense in
but
the
they
moment, at
In the moment.
sometimes,
they
especially to
do.
a 10-year-old.
Oh yeah, of course.
10-year-old me fully was like, that
But
makes a lot
like
of sense.
that's not necessarily like not normal. Like I mean,
Yeah.
OCD will often have thoughts, and you're like, yeah, I know that doesn't really make a lot of sense,
Yeah.
but you know, in a way it does, and that's
Yeah.
enough. And yeah,
Another
it's
one,
yeah,
last question. Last
okay.
question, and then we can go away, and I'm gonna catch Great British Bake Off. That was my
Ooh.
actual cutoff, is that I have to be done with this in time to watch British Bake Off.
Fair enough.
Um, Adding to your list is, can autistic burnout, which does match a lot of the stress, boredom, tiredness, can that cause an OCD flare up, or can the stress of being in an OCD thought spiral cause the burnout?
I'd say yes to both.
Yeah.
Mm,
That's chicken or
Um.
egg, but I can see going through a spiral, I can see leading to the autism burnout, but also autism burnout being one of those moments where OCD sneaks in the back door.
yeah,
Though I'm not sure how much OCD tolerates burnout.
yeah,
Um, you know, it's the kind of thing that, you know, you can be burnt out and you still have to do all your rituals all the same. I suppose
yeah.
it'll maintain your burnout in that way. You won't be able to do anything but the rituals. It's
Mm.
amazing. You'd be amazed. Like I look back on my life and I'm amazed at the things that I was able to
Oh my God.
withstand.
My, I got my all my educational reports from a kid when I was a kid, and I was shocked by my attendance the year I had that thought spiral.
Yeah.
I I genuinely don't know how I managed that.
It's amazing what you can survive when you're
Yeah.
undergoing that kind of pain and trauma. Just shows
I
how
don't
strong you.
remember any of it. I don't remember most of it, but I was there. There's documentation.
Yeah, there's documentation you went through. It's proof.
Yeah.
But yeah, it's amazing what people with OCD can withstand.
Yeah.
Mm,
Really is. Even I look back on my own life and like, how did I do that?
yeah.
Like,
Well, you have a sister who definitely was a good sidekick.
yeah,
Mm.
I know. What can you do?
Okay. So we
Yeah,
might wrap this up here. Like
cool.
I will be sending out the recording and the slides and the notes tomorrow, which has the list of books and podcasts and forums and all that good stuff that Leslie and Alex mentioned. I would also say that this is part of a series that I
Mm.
try to increase of autism and co-occurring condition. So if you have any suggestions of other co-occurring conditions that we would cover, I'd love to hear them. You can send that to support@asam.ie. And I'm building up next year's program at the moment, so I'd love to hear any suggestions for co-occurring conditions that we could cover. But other than that, I'd like to say thank you to Leslie and Alex for doing such an amazing webinar. I think this is really important, and I think it will
Thank
help
you.
even more people when
Thank
the
you.
recording is
Yeah,
available.
no, it's a great opportunity. I love to spread awareness about OCD. It's something that I think most people don't understand just how severe it is and are really struggling to try and find a way out of. So
And
I'll do
also
my part to do that.
the awareness of the overlap with OCD and autism, I just think is so vital to get that information out there. But, Bridget, selfishly, thank you for the opportunity to work with yourself and Alex. It's just been such a
Yeah.
pleasure.
Yes, it has been a pleasure.
I got to see Alex Katz.
Yes, you did.
Mm.
Yeah, okay.
Well, I'm
Thank
always
you.
bad at signing these things off, so I will just say good night.
Good night.
Night.
Bye.